Hello, Susanna here with my little sidekick Oliver. Today's video is talking about how to help a baby who has a cold, because poor little Ollie here has a cold. He's coughing, he's congested. He doesn't have a fever, which is good. The first thing is, for a little guy like this, there's really not much that they can take in the way of medication or that I'm comfortable giving him. One of the things I really like, and it's safe for pregnancy and breastfeeding and even newborns, is to use homeopathic remedies. This is the product I like to use. I'm probably mispronouncing that, but I think it is pronounced oscillococcinum. I will put a link to this product to find it on Amazon in the description of the video. Now, this tube is filled with teeny tiny pellets. And these tiny pellets, this entire tube is a full dose for an adult. Because the pellets are so small, it is really easy to just put 2 or 3 in the baby's mouth for a much smaller dose. It works for fevers, it works for colds, it works for flus. And if you're skeptical, read the Amazon reviews. I think there's like close to 20,000 reviews on there just singing the praises of this. So this is my remedy number 1 when cold goes around, oscillococcinum. And I keep this in the house all the time. This is one of my first aid supplies that I never run out of. Open big. That's a good boy taking your medicine. Since the little guy is coughing, I also use a chest rub. On my blog, you will find the recipe for the chest rub that I use for the rest of the family. I think there might even be a video about it here on my YouTube channel. But for the baby, I want to use something that's safe for babies. And rather than making a separate chest rub just for him, I buy these 2 ready ones. That's this one. And then good old Vicks Vapor Rub, but in the infant safe version. And I love both of these. They have different ingredients, so I actually use both of them. I rub some on his chest, some on his back, and some on his feet. And then I cover his feet with socks. And of course I put clothes back on him, just to make sure that the baby doesn't accidentally touch the chest rub and then rub his eyes or face with that, because that would burn his little eyes. The little Olipop. The little Oliver, you like that? That feels good. You're gonna feel so much better. The little Olipop. Virtually anytime the kids are congested, so that could be from a cold, that could be from the flu, it could even be from teething. My kids tend to get an ear infection along with it, or even just pressure on the ears. This is a remedy that I've been using for probably since Solomon was a baby, so over 20 years now. Obviously not the same bottle. This keeps for about 2 years, and I always have this in my first aid cabinet also. So this is a must in my first aid cabinet. It's called garlic mullein oil. It's difficult to see because it's oil-based and the oil kind of ran down. And it's made by a company called Herb Farm. And again, I will put a link to this in the description below. And what this does is that it is an alternative to using antibiotics to clear up an ear infection. This is not safe to use if the eardrum is punctured, but that's a really unlikely scenario. In 21 years of parenting 12 kids, I've never had to deal with that, but I've used this garlic mullein oil countless times. Now, the way I do the garlic mullein oil is that I have a cotton ball, and then from the cotton ball, I just tear off a little cotton, and I put just 1 drop into the dropper, just a tiny amount. And you want to lay the baby on his side and have the dropper ready to go, and just drop that 1 drop in the ear canal. Follow it with a cotton. And then just gently push it in the ear canal. There you go. Good job. And then you repeat on the other side. You did a good job. You did a fine job. And you can expect that to start working within the first 24 hours. You might be concerned about putting cotton in the baby's ears, that it could just go down the ear canal and get stuck. That's not going to happen. The ear canal has hairs in it, kind of like a nose has hairs in it. And those hairs are made to move everything forward. So even though you put cotton in there, it will all get moved forward and it will come out again. In fact, by the time they need their next dose, the cotton will probably already have fallen out. So I do that always before bedtime and then just 3-4 times throughout the day. Pretty much just around the clock basically until they start improving. And then I continue for a couple more days because you don't want the bacteria to kind of survive. And then before it's all eradicated, you stop treating it and then it comes back with a vengeance. So you do want to, just like with the antibiotics, you keep going for a few more days. You want to do that with the garlic mullein oil also. You might think, how do I know if my baby has an ear infection? You can buy an otoscope to check their ears. I used to have one, but frankly, I haven't used one in many years because I find the baby's behavior is a better indicator. And the number one bell ringer that the baby is having an ear infection is if you get them to sleep. And if you lay the baby down and they're asleep, they immediately wake up crying. That's usually an indicator that their ears are hurting and that the pressure increases when they lie down and they wake up crying from that pain. I hope something in this video was helpful to you. And if you're dealing with a sick baby, I hope they recover quickly and that these remedies work. Thank you for watching.